If your blood pressure looks normal, but you feel dizzy and foggy every morning, your body is already warning you about a hidden danger. After 60, the real threat may not be high pressure. It could be pressure pushed dangerously low by your own medication. When pressure drops too low, your brain loses oxygen, your kidneys fail to filter, and your heart quietly begins to starve. That dizziness when you stand up is not just aging, it is orthostatic hypotension, and it has caused thousands of dangerous falls. The pills you trust may actually be draining blood flow from the very organs keeping you alive and independent every single day. We follow standard charts, but your body after 60 does not follow standard rules, and that gap could be silently hurting your health. Today you will learn the exact numbers that may be too low for your age and what to tell your doctor immediately. Do not skip this video because what you hear next could explain every symptom you have been blaming on old age. Today we are going to discuss one of the most misunderstood and quietly dangerous health situations affecting millions of adults over the age of 60, which is blood pressure that has been pushed dangerously too low. In which session we will cover exactly why low blood pressure after 60 is a hidden threat, how your medications may be doing more harm than good, and what safer targets actually look like for you. Most people spend their entire adult lives worrying about high blood pressure, and that fear is completely understandable because high blood pressure has been linked to strokes, heart attacks, and kidney failure for decades now. But here is what almost nobody tells you clearly enough. After the age of 60, your blood pressure dropping too low can be just as dangerous and sometimes even more immediately harmful than high readings. When your blood pressure is too low, your brain is the very first organ to suffer because it sits at the highest point in your body and needs a consistent, strong push of blood flow. That lightheaded feeling you get when you stand up too fast from a chair or from your bed in the morning is not just a normal part of aging. It is a real medical warning sign you should recognize. That condition is called orthostatic hypotension, and it means your blood pressure is dropping suddenly when you change position, leaving your brain temporarily starved of the oxygen it desperately needs right then. When your brain loses oxygen, even for just a few seconds, you feel dizzy, your vision goes dark around the edges, your legs feel weak, and you become extremely vulnerable to a dangerous fall at that moment. Falls are one of the leading causes of serious injury and death in adults over 65. And many of those falls happen because blood pressure was simply too low at that exact moment of standing. Now let us talk about why this is happening to so many seniors who genuinely believe their health is actually under control. Because the answer may surprise you and possibly even upset you deeply. For years, major medical guidelines encourage doctors to push blood pressure targets lower and lower, aiming for systolic numbers below 120 in many older patients, regardless of individual health situations. The idea behind this aggressive approach was simple in theory. Lower pressure means less strain on the heart and blood vessels, which should mean fewer strokes and heart attacks over time for everyone. And while lowering genuinely high blood pressure absolutely saves lives, the real problem begins when medications push your numbers down too far below what your aging body actually needs to function normally every day. Your body at 65 or 70 is fundamentally different from your body at 40. Your blood vessels have become stiffer, less flexible, and they rely on a certain minimum level of pressure to work. Think of your blood vessels like old garden hoses that have lost their elasticity and flexibility over the years. If you reduce the water pressure too much, the water barely trickles out at the far end. The same thing happens inside your body. When blood pressure is pushed too low, your blood moves too slowly, your organs receive less oxygen, and your entire system starts to weaken quietly from the inside out. Your brain needs approximately 15 to 20% of your total blood supply just to maintain normal function, which includes thinking clearly, maintaining balance, processing your vision, and managing your emotions every single day. When blood pressure drops below the threshold your brain requires, you may start experiencing brain fog, difficulty concentrating, forgetfulness, confusion, and even personality changes that people blame entirely on aging. Many seniors and even many family members assume that this mental decline is just dementia starting, but in some cases the real cause is simply not enough blood reaching the brain because pressure is too low. This is one of the most heartbreaking misdiagnoses in senior health. A person who appears to be losing mental sharpness may actually just need a simple adjustment in blood pressure medication to feel clear again. Now let us look at what is actually happening inside your arteries and veins when blood pressure is being forced down too aggressively by multiple medications working at the same time inside your body every single day. Your arteries are muscular tubes that expand and contract with every single heartbeat to push blood forward through your body. And as you age, those artery walls become thicker and much less elastic over time. When your artery walls are stiff, they cannot expand as easily, which means your heart has to pump harder to push blood through. And this is actually why blood pressure naturally rises somewhat with aging. A certain degree of that rise is actually your body compensating intelligently. Your system is trying to make sure blood still reaches your brain, your kidneys, your eyes, and every other vital organ that depends on circulation. But when you take medications that force your blood pressure down to a number designed for a younger, more flexible vascular system, you are essentially overriding your body's own protective compensation mechanism that keeps organs alive. Your heart is now pumping against stiff vessels, but with reduced force. So the blood that reaches your brain and kidneys is significantly less than what those organs need to perform their critical daily functions properly. Your kidneys are especially vulnerable to this situation because they filter your entire blood supply multiple times every single day, and they depend on steady, consistent pressure to do their filtration work correctly and efficiently. When blood pressure drops too low, your kidneys cannot filter waste products properly. Fluid balance becomes disrupted, and toxic byproducts begin to accumulate in your blood, which creates a dangerous chain reaction inside your body. Many seniors who experience swollen ankles, unexplained fatigue, reduced urine output, or a strange metallic taste in the mouth may actually be experiencing early signs of kidney stress caused directly by pressure being too low. Now here is another critical danger that almost nobody discusses openly. Low blood pressure significantly increases your risk of a specific type of stroke that is caused not by a burst vessel, but by insufficient blood flow. This type of stroke is called an ischemic stroke, and it happens when blood flow to a part of the brain becomes so weak that brain cells begin to die from oxygen starvation, even without any vessel actually rupturing or breaking. So while you are taking medication to prevent a stroke from high pressure, that same medication pushed too far could actually be increasing your risk of a stroke from low pressure, which is a terrifying contradiction most people never consider. Let us now talk about your heart itself, because your heart muscle is also an organ that needs its own blood supply delivered through the coronary arteries, and low pressure affects your heart directly in a very dangerous way. Your coronary arteries supply oxygen-rich blood to the heart muscle itself, and when overall blood pressure is too low, the heart may not receive enough oxygen to pump efficiently, which can trigger chest pain called angina or worse. In some severe cases, dangerously low blood pressure can lead to a heart attack, not because an artery is blocked by plaque, but because there simply was not enough pressure to push adequate blood through narrowed coronary arteries to the heart muscle. So you need to understand this very clearly. Low blood pressure does not mean safe blood pressure. And a number that looks good on a chart may actually be slowly starving your most vital organs of the oxygen they require every moment. Now let us talk about symptoms you might already be feeling every single day, but dismissing as just normal aging. Because recognizing these warning signs early could literally save your life or protect your independence for years. The first major warning sign is chronic fatigue that does not improve with rest. If you sleep a full night but still wake up feeling exhausted and drained, your blood pressure may be too low to deliver enough energy to your cells. The second warning sign is frequent dizziness, especially when standing up, bending over, or changing position quickly. This is your brain telling you very directly that it is not receiving the blood flow it needs at that moment. The third warning sign is brain fog and difficulty concentrating. If you find yourself reading the same sentence 3 times or forgetting why you walked into a room, low blood pressure may be directly responsible for this frustrating experience. The fourth warning sign is blurry vision or temporary visual disturbances. Your eyes are incredibly sensitive to blood flow changes, and even a small drop in pressure can affect the tiny blood vessels feeding your retina and optic nerve. The fifth warning sign is nausea or feeling faint after meals. This is called postprandial hypotension, and it happens because your body diverts blood toward your stomach for digestion, dropping pressure even further throughout the rest of your body. The sixth warning sign is cold hands and feet, even in warm weather. When blood pressure is too low, your body prioritizes sending limited blood supply to your brain and heart first, leaving your extremities cold and poorly nourished. The seventh and most dangerous warning sign is episodes of fainting or near fainting. If you have blacked out even once or felt like you were about to lose consciousness, you must tell your doctor immediately because this is urgent. If you are experiencing 3 or more of these symptoms consistently, there is a very real possibility that your blood pressure medications are pushing your numbers below the safe functional range your specific body actually needs to operate properly. Now let us discuss the specific medications that are most commonly involved in pushing blood pressure too low in older adults. Because understanding what you are taking is the first step toward protecting yourself from this hidden danger. Beta blockers are one of the most commonly prescribed blood pressure medications, and they work by slowing your heart rate and reducing the force of each heartbeat, which lowers the pressure inside your arteries with every single pump. While beta blockers are very effective at controlling high blood pressure, in some older adults, they can slow the heart too much, causing fatigue, dizziness, cold extremities, and dangerously low blood pressure, especially during physical activity or when standing. Diuretics, sometimes called water pills, are another extremely common blood pressure medication, and they work by forcing your kidneys to remove more water and salt from your blood, which reduces total blood volume inside your system. The problem is that in older adults who may already be mildly dehydrated or not drinking enough water, diuretics can reduce blood volume too much, causing a sharp drop in blood pressure that leads directly to dizziness and dangerous falls. ACE inhibitors and ARBs are another major class of blood pressure medications, and they work by relaxing and widening your blood vessels, which makes it easier for blood to flow through with less pressure needed from the heart. But in some seniors, especially those who are frail or taking multiple medications at the same time, this vessel relaxation can go too far, causing blood pressure to drop below the level needed to properly supply the brain and kidneys. Alpha blockers are sometimes prescribed for blood pressure or prostate issues, and they also relax blood vessels, but they carry a particularly high risk of causing orthostatic hypotension, that dangerous sudden drop when you stand up from a seated position. Now here is the critical point that ties all of this together. Many seniors are not taking just one blood pressure medication. They are taking 2, 3, or even 4 different types simultaneously, each one lowering pressure through a different mechanism. When multiple medications are combined, the blood pressure lowering effect can stack up in ways that no single drug would cause alone, creating a combined drop that pushes your numbers into a truly dangerous low territory without anyone noticing immediately. This is called polypharmacy, and it is one of the most common and most overlooked dangers in senior healthcare today, because each medication was prescribed individually, but nobody recalculated the total combined effect on your body as a whole. Now let us talk about what blood pressure numbers may actually be too low for adults over 60. Because this is the information that could change everything about how you feel every single day going forward from this moment. In general, if your systolic blood pressure, which is the top number on your reading, is consistently dropping below 110 while you are on medication, that may be too low for an older adult body to function optimally. Some experts and geriatric specialists argue that for adults over 70, a systolic reading between 130 and 140 may actually be a safer, more functional range than the aggressive targets that many standard guidelines still recommend. This does not mean high blood pressure is acceptable or safe. It absolutely is not. But it means that the ideal target for your body at your specific age and health status may be different from the standard chart your doctor uses for younger patients. The original medical term for high blood pressure in aging adults was actually essential hypertension, because doctors once believed that higher pressure was essential for pushing blood through stiff, aging vessels all the way up to the brain effectively. While that old view was too extreme, there is real scientific truth buried inside it. Your aging vascular system does need a certain minimum level of pressure to deliver blood effectively to your brain, kidneys, heart, and every other vital organ. The landmark SPRINT trial studied aggressive blood pressure treatment and found cardiovascular benefits from targeting systolic pressure below 120. But that trial also raised important questions about side effects in older, frail patients specifically. Critics of overly aggressive targets point out that the SPRINT trial measured blood pressure using a very specific automated method in quiet research settings, which often gives readings that are 5 to 15 points lower than typical doctor office measurements. This means that a reading of 120 in the SPRINT trial setting might actually be equivalent to 130 or 135 in your doctor office, which is an important detail that changes how results should be interpreted. So if your doctor is aggressively targeting 120 based on office readings, your actual real-world pressure may already be dropping well below 110 at various points throughout your day, especially at night while you sleep. Nighttime blood pressure drops are particularly dangerous for seniors because your body naturally lowers blood pressure during sleep. And if medications are already pushing you low during the day, nighttime levels can fall into a critically dangerous zone. During these nighttime drops, blood flow to your brain slows dramatically, and this is one reason why some seniors wake up feeling confused, disoriented, or unusually groggy. Their brain was essentially oxygen deprived for hours while they were sleeping. In the worst cases, severe nighttime blood pressure drops have been associated with increased risk of silent strokes. These are small strokes that happen without obvious symptoms, but gradually damage brain tissue and reduce cognitive function over many months. So that slow mental decline you or your family members have been noticing might not be the beginning of dementia at all. It might be the accumulated result of months or years of nighttime blood pressure drops, starving your brain of oxygen repeatedly. Now let us talk about what you should actually do with all of this information, because knowledge without action will not help you. And the steps you take after watching this video could genuinely improve your quality of life dramatically, starting very soon. The first and most important step is to start measuring your blood pressure at home using a reliable automatic arm cuff monitor, because a single reading in the doctor's office does not tell the full story of what your pressure does all day. Measure your blood pressure at the same times each day, once in the morning before taking medications and once in the evening, and write down every single reading in a small notebook or on your phone so you can track the real pattern over time. Pay special attention to how you feel when your numbers are lower. If your systolic reading is below 110 and you feel dizzy, foggy, or weak, that is critical information you need to share with your doctor immediately. The second important step is to test for orthostatic hypotension at home. Take your blood pressure while sitting comfortably for 5 minutes. Then stand up and take it again after 1 minute, and again after 3 minutes of standing quietly. If your systolic blood pressure drops by 20 points or more when you stand up, or your diastolic drops by 10 points or more, that is a clinical sign of orthostatic hypotension that your doctor absolutely needs to know about right away. The third critical step is to have an honest, open conversation with your doctor about whether your current blood pressure target is truly appropriate for your specific age, your specific health conditions, and your actual daily symptoms and functional abilities. Do not be afraid to ask your doctor this specific question. Is my blood pressure target based on guidelines meant for younger, healthier patients? Or has it been individually adjusted for my age, my frailty level, and my other medications? A good doctor will welcome this question and will be willing to discuss whether a slightly higher target, perhaps 130 to 140 systolic, might be safer and more functional for your individual body and daily life. The fourth step is to ask your doctor to review all of your medications together at once, not just blood pressure drugs, because other medications you take for pain, sleep, anxiety, or prostate issues may also be contributing to lowering your pressure. Sometimes simply adjusting the timing of when you take certain medications, such as taking blood pressure pills at night instead of morning, or splitting doses differently, can prevent dangerous daytime drops without changing the medications themselves at all. The fifth step is to stay properly hydrated every single day. Many seniors do not drink enough water because their thirst sensation decreases with age. But dehydration combined with blood pressure medication is a recipe for dangerously low readings and falls. Aim for at least 6 to 8 glasses of water throughout the day. And if you are taking diuretics, ask your doctor whether you need to increase your fluid intake even more to compensate for the extra water those specific medications are removing from your body. The sixth step is to be extremely careful when changing positions. Always sit on the edge of your bed for at least 30 seconds before standing up in the morning, and rise slowly from chairs by pushing up with your arms first. This simple habit gives your cardiovascular system time to adjust your blood pressure before you are fully upright and bearing weight on your legs. And it can prevent the sudden drops that cause dizziness, vision blackout, and dangerous falls in your home. The seventh step is to eat smaller, more frequent meals instead of large, heavy meals, because large meals divert a significant amount of blood to your digestive system, which can cause postprandial hypotension and leave your brain dangerously short of blood supply. The eighth and final step is to talk to your family about what you have learned today. Make sure someone close to you understands that your dizziness, confusion, or fatigue may not just be aging. It may be a medication problem that can be fixed. Having a family member who understands this situation can be life-saving because they can advocate for you at doctor appointments, watch for warning signs you might not notice yourself, and help you track your blood pressure readings consistently at home. Now let us bring this all together with the most important message of this entire video. Your blood pressure number is not just a score to get as low as possible. It is a vital sign that must be balanced carefully for your body. Too high is dangerous, and too low is equally dangerous. And the right number for you is one that protects your heart and brain while still allowing enough blood flow to keep you sharp, steady, energetic, and independent every single day. You deserve to feel alert, clear-headed, stable on your feet, and full of energy. And if your current blood pressure management is robbing you of those things, then something needs to change, and it needs to change as soon as possible. Do not accept feeling dizzy, foggy, or exhausted as just part of getting older, because in many cases, these symptoms have a fixable medical cause, and that cause may be sitting right there in your medicine cabinet, waiting to be properly adjusted. If this video helped you understand something about your health that nobody else has explained, please share it with someone you love who might be suffering from the same silent problem without even knowing the real cause of their symptoms. Subscribe to this channel right now and turn on notifications because every single week we bring you the most important health information that seniors need to hear, the kind of information that can protect your life and your independence for years to come. Thank you for watching all the way to the end. That tells us you truly care about your health, and we want you to know that taking action on what you learned today could be one of the best decisions you make this entire year for your well-being. Stay safe, stay informed, stay strong, and remember that your body is always sending you signals. You just need to learn what those signals truly mean and then have the courage to act on them before it is too late. We will see you in the next video where we will cover another hidden health danger that millions of seniors are completely unaware of. So do not miss it because it might be even more important than what we discussed today.